Did you know your bones are responsible for protecting internal organs, providing structure to your body, and storing essential nutrients? So you'd better keep them healthy. Keep watching for tips to do just that. If you have concerns about your bone health, talk to your doctor about it. They can evaluate your health history and lifestyle influences to assess whether you are at high risk for osteoporosis. They can suggest a number of things you can do to improve your bone health, including dietary changes, more exercise, and taking prescribed supplements or medications. You may be aware of the link between calcium and better bone health. Calcium does more than just strengthen your bones. It also helps your muscles to move and your nerves to communicate between the brain and the rest of your body. According to the National Institutes of Health Office of Dietary Supplements, almost all calcium is stored in bones and teeth, where it supports their structure and hardness. But just how much does your body require to function properly? While individual calcium needs vary by life stage, adults between the ages of 19 to 50 should aim to consume 1,000 milligrams daily. Men between 51 and 70 can continue on with this recommendation, whereas women in this age bracket should increase their intake to 1,200 milligrams each day. The Bone Health and Osteoporosis Foundation offers a handy guide to calcium-rich foods. Many dairy items top the list. An 8-ounce glass of milk contains 300 milligrams of calcium, and a 6-ounce container of plain, low-fat yogurt offers 310. You can also find high levels of calcium in leafy green vegetables like kale and collard greens, in some types of seafood, and in fortified foods and drinks, including almond milk and orange juice. Although most health experts recommend getting nutrients directly from food, calcium supplementation may be beneficial if you are at risk for osteoporosis. To maintain strong bones, you're going to want to get plenty of vitamin D. Healthline reports that vitamin D is crucial for boosting bone health, along with improving immune function and providing protection from cancer, diabetes, high blood pressure, and other serious health conditions. Vitamin D also enables your body to absorb calcium per the Bone Health and Osteoporosis Foundation. That said, it is also one of the most common vitamin deficiencies experienced around the world. In the United States, up to 42% of adults have low levels of vitamin D, with Black and Hispanic populations disproportionately affected. Potential sources of vitamin D include sun exposure, food, and supplements, but these days people are spending more and more time indoors away from the sun. When they do go outside, they are more likely to use sunblock or wear protective clothing, impacting the amount of vitamin D received. Healthline reports that you should consume 800 international units of vitamin D from foods daily, but you may want to aim closer to 1,000 IU if you don't spend much time outdoors. Healthy foods high in vitamin D include salmon, herring, sardines, cod liver oil, canned tuna, egg yolks, mushrooms, and fortified items like milk, orange juice, and cereal. If you consume enough calcium, eating more protein may benefit your bones. A 2014 research study published in Current Opinion in Clinical Nutrition and Metabolic Care suggested that greater protein intake can improve bone health in adults, but only when adequate calcium is consumed. While further research is needed to better understand this connection, we already know that eating enough protein offers a lot more health benefits than just strengthening your bones. Medline Plus touts proteins as the building blocks of life, since adequate protein intake allows your body to repair cells and make new ones.
120 calories and 48 calories from fat. What percent is that?
Very Well Fit offers a convenient calculator to determine your body's individual protein needs. After finding the number of calories you burn each day based on age, weight, height, and activity level, you multiply this number by 10% to 35% to estimate a range of how many protein calories you should eat. Or, to think in terms of protein grams, each gram of protein has 4 calories. So simply divide your protein calorie goal by 4. Good sources of protein include both animals and plants, including meats, seafood, eggs, soy, beans, legumes, nut butters, and some grains. According to the American Orthopedic Society for Sports Medicine, exercise helps your body maintain its bone mass, along with reducing bone loss that occurs naturally with aging. All exercise is good, but when it comes to bone health, a combination of resistance training and weight-bearing exercises is best. Resistance training, also known as strength training, can involve the use of weight machines, free weights, resistance bands, or body weight to place stress on the bones. This increases bone density and reduces the risk of osteoporosis per the Mayo Clinic. Examples of weight-bearing exercises include activities like walking, jogging, dancing, household chores, and yard work. WebMD also recommends Tai Chi, yoga, golf, and racket sports. All of these activities involve muscles and gravity to place weight on the bones, making them stronger. You may be surprised to learn that some medications can negatively impact bone density. American Bone Health recommends reading the fine print on medication labels. Some medicines can cause bone loss, some may increase your risk of a fall, and some may increase the chance of breaking a bone. Keep in mind that just because some medications place you at increased risk for bone issues doesn't mean you should automatically stop taking them. Often, the benefits of taking prescribed medications outweigh the risks. This is an individual decision that should involve open conversation between you and your doctor. Medications that impact bone density include high doses of cortisone-like pills, such as prednisone, high doses of thyroid medications, drugs that reduce estrogen or androgen levels, some diabetes medications, certain stomach medications, some antidepressants, blood thinners, and anticoagulants, loop diuretics, and some anticonvulsant medications. If you are at high risk for poor bone health, make sure you're getting enough calcium, vitamin D, protein, and exercise. You may also wish to ask your doctor about taking osteoporosis medication for preventative purposes. Maintaining a healthy weight is another important thing you can do to improve your bone health. Eating disorders are a major risk factor for poor bone health. Among young women with anorexia nervosa, at least half will develop osteoporosis, according to 2015 research in Eating Disorders Review. Unfortunately, even after recovery, some of the damage may be irreversible. Treatment focuses on weight restoration, good nutrition, and monitored exercise. Being underweight for any reason may place you at risk for bone problems, the Chicago Tribune reports. Thin, small-boned women have an increased risk of osteoporosis, particularly if they are undernourished. Vitamin and mineral deficiencies contribute to hip fracture because they speed up bone loss, contribute to impaired coordination, and reduce the body's ability to protect itself during a fall. Achieving a healthy weight and eating well can help underweight individuals build stronger bones. So if being underweight is bad for bones, does that mean being overweight is good? Researchers investigated the effects of body weight on bone mineral density during a 2012 study for the Annual Review of Nutrition. They not only concluded that obesity compromises bone quality, they also determined that caloric restriction can result in bone loss, meaning not only can excess weight cause damage, the act of dieting may also be problematic. If you wish to lose excess weight and keep your bones strong, talk to your doctor. We all know smoking is harmful, but did you know it can impact your bones? According to Russell Stitzline, MD, of the UC Irvine School of Medicine's Department of Orthopedic Surgery, smoking reduces the blood supply to the bones and to many other body tissues. The nicotine in cigarettes slows production of bone-producing cells and decreases the body's absorption of calcium, which is necessary for vital cellular functions and bone health. Smoking affects the balance of hormones, including estrogen, which is needed to build and maintain a strong skeleton. You can strengthen your bones, reduce your risk for many diseases, and improve your overall health by quitting smoking.
Well, let's quit. We'll just quit. Let's all quit. It does sound appealing.
The Centers for Disease Control and Prevention points out that it's never too late and provides helpful information on how to be successful. While you may enjoy regularly knocking back a few drinks, know that your bones don't appreciate the alcohol. The National Institute on Alcohol Abuse and Alcoholism states that chronic heavy drinking can compromise bone quality and increase the risk of osteoporosis. This is particularly true when heavy drinking occurs in adolescents and young adults. Maybe even more concerning, research suggests that alcohol-induced bone damage cannot be reversed, even if you later abstain. Heavy and chronic drinking can lead to bone disease by contributing to decreased bone formation, increasing fractures, and preventing fractures from healing normally. When a bone fracture occurs, it would be wise to avoid alcohol entirely. In general, we suggest adhering to expert guidelines for the safe consumption of alcohol. For adults over 21, this means no more than 2 drinks per day for men and no more than 1 drink a day for women. A 2020 research abstract in Archives of Osteoporosis suggests a connection between the hormone dihydroepiandrosterone, or DHEA, and increased bone mineral density. DHEA is produced naturally in the adrenal gland. It helps produce other hormones, including estrogen and testosterone, per the Mayo Clinic. A synthetic version is sold as a nutritional supplement. On his YouTube channel, Dr. Eric Berg, DC, discusses a number of things you can do to improve your bone health. For one, he recommends taking 10 to 15 milligrams of DHEA if you have osteopenia, the precursor to osteoporosis. Science Daily also reports on the potential benefits of DHEA hormone replacement for bone health. Research suggests that older women taking a DHEA supplement along with calcium and vitamin D may experience improved spinal bone density. If you are interested in DHEA supplementation, discuss the pros and cons with your doctor before getting started. Since DHEA can increase estrogen and testosterone production in the body, taking it may also increase your risk of developing some types of cancer. Although vitamin K is better known for its association with blood clotting, there appears to be a link between this essential nutrient and bone health. According to American Bone Health, studies have shown that poor vitamin K intake is linked to low bone mass, osteoporosis, and fracture risk. Women who consumed less than 109 micrograms of vitamin K per day were found to be more likely to break a hip. Low vitamin K intake has also been linked to increased risk of hip fractures in men and women and to low bone density in women. Before you rush out for a bottle of vitamin K, there are a few things you should know. First, vitamin K comes in two forms: vitamin K1, typically found in leafy greens and cruciferous vegetables, and K2, mostly produced in gut bacteria, but small amounts can be found in certain foods. Although both types may play a role in bone health, the link is stronger with vitamin K2. Similar to other supplements, vitamin K from food can benefit the body more than when taken in a supplement form. Foods containing vitamin K2 include grass-fed meats, dairy products, and some fermented foods. The Cleveland Clinic specifically suggests hard cheeses like Gouda and Swiss, blue cheese, chicken, pork, eggs, and fermented soybeans. One way to prevent fall-related injuries is to make sure your surroundings are as safe as possible. An estimated 8.9 million fractures worldwide can be attributed to osteoporosis, according to Healthline. This means one is happening about every 3 seconds. Yikes.
Oh, son of a... That's gonna leave a mark.
Women over 50 are most heavily affected, with 1 in 3 experiencing a fracture related to osteoporosis. For men over 50, the odds are 1 in 5. The most common types that occur are vertebral, forearm, wrist, and hip fractures. Everyday Health suggests a number of things that you can do to reduce your fall risk. These include cleaning up clutter, repairing or removing trip hazards, including loose carpet and throw rugs, installing grab bars and rails, not wearing loose clothing, installing brighter light bulbs, avoiding stairs when possible, and generally moving around with greater caution. Healthline also recommends using night lights, keeping a flashlight near your bed, and walking on grass instead of sidewalks that may be slippery from fallen leaves, rain, ice, or snow. Along with making healthy lifestyle changes and doing your best to prevent falls, ask your doctor about taking preventative medications if you are at high risk for bone fractures. Per the Mayo Clinic, there are several possible options. One common class of osteoporosis medications are bisphosphonates. Denosumab is another common osteoporosis medication that may be prescribed instead for people with reduced kidney function. As with other medications, side effects can occur with osteoporosis medications. Some women may benefit from taking estrogen to boost their bone health. However, because estrogen can increase the risk of blood clots, endometrial cancer, breast cancer, and possibly heart disease, this should be carefully considered. Check out one of our newest videos right here. Plus, even more Health Digest videos about wellness are coming soon. Subscribe to our YouTube channel and hit the bell so you don't miss a single one.